My name is Felicia Marshall, the COVID-19 Town Hall Lead and Chair for Emergency Response Team, a Southfield alumni chapter of Delta Sigma Theta Sorority Incorporated. Thank you for attending the Southfield Alumni Chapter virtual COVID-19 Town Hall. Today, you will hear from leading policymakers and physician experts about COVID-19 and topics such as such as the coronavirus vaccine treatment options, vaccine distribution, COVID-19 healthcare disparity, and the impact this pandemic has had on the local community, especially people of color. The panelists will be introduced shortly. Each panelist will answer important questions and provide pertinent information that you will need to know. Afterwards, we will answer a few questions from the audience, and the selected panelists will answer the question. You're welcome to place your questions in the chat during the event. The top most frequent questions will be answered. Learning as much as we can about COVID-19 holds the key for us to improve our chances to staying safe and making the best choices to stay healthy. I would like to thank our President, Kimberly Calloway, the Emergency Response Team Committee, Social Action, and Physical and Mental Health Committees for making this event possible. Also, thank you to the ERT leads for the beautiful reflection in memory of those who have lost their lives and for those who have been severely impacted concerning this, has been affected by this pandemic. I would also like to thank our esteemed panelists and amazing moderator for helping with the mitigation of the spread of the coronavirus and taking the time to share very valuable information to help us to make informed decisions. At this time, I would like to introduce the Chair of Southfield Alumni Emergency Response Team, Aletha Jones. Following her, President Kimberly Calloway with the President message and greeting, and then introduction of the moderator and the panelists by Lorena Robbins in that order. Thank you.
Good morning and welcome. We greet you with open arms. We are elated that you have made the conscious decision and effort to join us on this morning. We ask that you sit back, relax, take notes, and ask questions, and also engage with us today. Thank you for attending another sensational session. We value you and we treasure your presence. Again, thank you and welcome.
Good morning. I am the proud president, Kimberly Owens Calloway, and on behalf of the over 500 member strong, sensational Southfield Alumni Chapter of Delta Sigma Theta Sorority Incorporated, where we are magnifying sisterhood and service, I welcome you to our COVID-19 Town Hall. This is a collaboration between our Emergency Response Team, chaired by Aletha Jones, and Felicia Marshall, our Social Action Committee, chaired by Bridget Officer and co-chair Cerise Allen, and Physical and Mental Health Committee, chaired by Hawa Huff, all under the direction of our wonderful first Vice President, Venus J. Brown, who oversees our national initiatives. COVID-19 is a very serious issue that hit us in early 2020, and we are still dealing with it over a year later. We have, however, learned to pivot and are now navigating in this new norm. Education and awareness are key to staying safe and healthy. So thank you to our presenters for this very important and needed forum. A huge thank you to our subject matter experts and our panelists for the information that will be shared. And thank each of you for being here today to learn how we can stay healthy and prevent the spread of this terrible virus. Thank you. I now turn it back over to the committee.
Good morning. I would like to take this time to introduce our moderator and our panelists for our first COVID-19 Town Hall. Starting off with Latoya Henry. Latoya Henry is a member of Delta Sigma Theta Sorority Incorporated, Southfield Alumni Chapter. She is also a co-founder of the SAC Emergency Response Team Committee. Latoya has extensive experience in public relations and is an advocate and participant with the NAACP. Currently, she serves as Chief Strategist for LAH Strategies. Welcome, Latoya. Next, we have Dr. Kenesha Evans. Kenesha is an infectious disease control and antibiotic steward fellow at the Detroit Medical Center. She is a community public health advocate and a health educator in underrepresented communities. Welcome, Kenesha. Next, we have Dr. Chris Purnell. Dr. Purnell is a board-certified preventative medicine and public health physician. She's also an American College of Preventative Medicine HQ Fellow. She currently serves as the Chief Strategic Integration and Health Equity Officer at the University Hospital in Newark, New Jersey. And she's also one of the first physicians known to trial the COVID-19 vaccine. Welcome, Chris. Next, we have Dr. Letitia Carter-Blanks, MD and PH. Dr. Carter-Blanks is also a member of Delta Sigma Theta Sorority Incorporated Southfield Alumni Chapter. She is currently a pediatrician who has extensive work and research in the public health sector. And she's also a clinical assistant professor at the University of Michigan Medical School. Welcome, Letitia. Next, we have Congresswoman Brenda Lawrence. Brenda is also a member of Delta Sigma Theta Sorority Incorporated Southfield Alumni Chapter, and she's the former mayor of the city of Southfield, Michigan, serving many terms. And currently, she is our U.S. representative of the 14th Congressional District. Welcome, Brenda. Next, we have State Representative Regina Wise. Regina is a seasoned educator and also serves on the Oak Park City Council, and she's a well-known community leader. She currently represents the 27th House District. Welcome, Regina. And last, we have Tamar Pleasant Swain, MBA BSN. She is also a member of Delta Sigma Theta Sorority Incorporated, Flint Alumni Chapter, and she currently serves as the first vice president. Tamar is the National Program Director of Case Management at Ascension and also president of Coastal Roads Consulting. Welcome, Tamar. We appreciate you taking the time out of your schedule to share your knowledge, expertise, and experience with COVID-19. And now I would turn it over to our moderator, Latoya Henry. Thank you.
Thank you, thank you, Lorena, and welcome everyone. This is a subject that is very near and dear to my heart, and we have a lot of panelists with great information, and so we are going to get started. The first question will be directed to Dr. Purnell. Dr. Purnell, why do people of color seem to have higher transmission rates for the COVID-19 virus and appear to experience more severe complications, including death?
Thank you. Very, very good question. I think we have to start with the context. And the context where I always begin is that what we're seeing in our nation is actually the collision of two pandemics. It is the pandemic of systemic racism, if you will, and the pandemic of COVID-19. And it's that collision that has disproportionately devastated Black and Brown lives. If you look at statistics even published by the CDC, Blacks and Latinos and the indigenous community are anywhere from 3 to 4 times more likely to be hospitalized because of coronavirus. Blacks and Browns, meaning of the Latino and indigenous communities, are anywhere from 2 to 3.3 times more likely to have higher mortality if you look at both the data from the CDC and the data from the APM Research Lab in the Color of Coronavirus Project. But if you dig down even deeper and you consider intersectionalities, you begin to see that even within the age group of, per se, of 45 to 54, Blacks and Latinos are 6 times more likely than white Americans to die from coronavirus. Black women are disproportionately devastated with coronavirus mortality, more so than Hispanic or Asian or white men. And the reason why we are seeing that is because of the system of racism, systemic racism, I should say, which is a system of structuring opportunity, whereby one group is unfairly advantaged, another group is unfairly disadvantaged, but the strength of the society as a whole is sapped, as the illustrative Dr. Cameron Jones defines. So that means that Blacks and Latinos work in industries that are considered frontline and essential at higher rates than do white Americans. For instance, in Death by Racism, a piece that Professor Sherelle Barber wrote in The Lancet, it shows that Blacks and Latinos are anywhere around 43% higher in representation in the service and production industries. Those industries did not have adequate access to PPE earlier on in the pandemic. Those industries are jobs that people could not work remotely. Those are industries where employees did not necessarily have income protections so that they could afford not to go into work. Those same persons are persons who necessarily use public transportation more frequently. So not only do you have what is considered a riskier job because it's frontline and or essential, not only is that job frontline or essential, it's sometimes in more crowded working conditions, then you're also commuting to work, exposing you yet again to the higher risk of transmission. Finally, Blacks and Latinos have disproportionate rates of chronic health conditions. And those chronic health conditions are not just rooted in individual behaviors, they're very much the outcome of structural determinants, right? Where people live, work, play, worship, and pray. And we've seen that drive disproportionate rates in Black and Brown communities. And one other thing I just put on that is we know that Blacks have disparate experiences of healthcare, right? Dr. Jones goes further to says that racism works at the level of differential access to care. Racism works at the level of differential quality of the care received, and racism works at unfair and unjust differential access to the life conditions that would influence health and well-being. And that's why we're seeing the numbers that we're seeing.
Thank you, Dr. Purnell, for that very informed answer. The next question will go to Dr. Evans. There has been over a 15% rise in COVID cases here in Michigan. What is driving the surge of residents getting infected, and has the pattern of transmission for the COVID-19 virus and the new strain changed?
So these are they're kind of two separate questions, but it all builds on what Dr. Purnell just laid out for us. I mean, it's an excellent example. But on top of that, we have a period of time where we're now a year out from the pandemic, and we are unfortunately becoming numb to the numbers and the fatalities. We speak about these community advocacy panelist discussions that we have on a routine basis. For a lack of a better term, we're just getting tired of hearing the story. And with the rollout of the immunizations, it has been that we have this idea of a multifactorial approach in terms of us being fatigued. We have vaccinations that are being rolled out. We have people taking the vaccine, the understanding of if you have the vaccine now, you can be about your normal life. We also have a rise in the variants of cases. So particularly in the state of Michigan, we were, once the UK variant kind of hit the US, we were like second in terms of states that had the rising number. We went from in March being just a little bit over 600 for UK variant alone to now we having over 4,000 people with that virus. The other problem is that with the less restricted that we have become, the more lenient we as a society have been in terms of the things that we do. And that being wearing our masks, staying away from each other, not being so congregate at restaurants and bars, because we have noticed that we've had a rise in cases in terms of individuals younger from 10 to 19 years of age is where we have seen a rise in our cases as well. So with all of those things, I think that is the reason why we in the state of Michigan have gone to this high rate of 15 as terms of a surge from early March until now. I would say that we have now downtrend. I would use the idea of this 15% to say that the important thing for us to do is be we're not scared or we're in a good place is that we want to be 10% positivity. So that means that every person that comes in symptomatic or those that want to get screened, how much are those being positive? We want to be 10%. So when we are seeing the rising cases and our percent positivity rate going from 15 to at one point during this last month, we have been as high as 20% positivity rate in the state of Michigan alone. With that actual percentage, we also see the number of hospital beds that's 70% full in terms of the state as its entirety when that comes to that case. So although we're not, our fatalities are not in a place where that's surging, which is a tremendous blessing is the term I would definitely use. We're still a part in terms of like Wayne County alone, we're still a part of that top 10% of individual, or excuse me, that top 20 counties that have fatalities. So we hear that, and at the same time, we are a little bit more. I guess we're waiting until it actually hits home that we're doing something about it, and unfortunately, that is costing us to be in this high state. Although as of today, we have come down to -2%, so we're at about 13%. But the goal would be to be less than 10% positivity. To the second point of your question is this idea of has the patterns of transmission changed? So this is where that idea of what the variants mean. Now, that's not to say that the virus is not spreading via droplet or airborne, which is why we're wearing the mask and keeping 6 feet from one individual, but this idea that one corona is a cousin to another corona, meaning this UK variant, the South African variant, the Brazilian variant, the understanding that we're even studying even domestic within the states variants that may rise. And with that being said, it's like the survival of the fittest. So if not enough of us in terms of population is immunized, then that gives the virus the capability to replicate into something new. Viruses, unfortunately, don't follow rules and regulations. So it's one day could be one thing, and the next day it could be a different color. And unfortunately, those that become a different color of corona, SARS-CoV-2, are those that may be more transmissible and more deadly. And unfortunately, that's what we're seeing with the UK variant. It's more transmissible. We have become a lot more aware of what to do when the virus comes and people become symptomatic. So our knowledge of what to do has gotten better. So that is a positive, but at the same time, as the numbers continue to rise and we allow the virus to continue to take its course and not meet that match with immunizations, then we'll start to see more and more different types of variants, unfortunately.
Okay, thank you, Dr. Evans. And the next question is for you as well. It's along the lines of hospitalization rates. Can you provide insight into the COVID-19 hospitalization rates that the state of Michigan experienced in 2020 and compare it to what we've experienced in the first quarter of 2021? And has there been an increase? And we hear the term wave. Are we in a particular wave right now?
Yes. So it's basically if you saw a bell curve and you saw the curve going up and down. Everything that I speak to, I use two websites that I think are very pertinent, particularly for us in the state of Michigan. It's the Michigan Department of Health and Human Services, so mdhhs.gov. That actually provides this spectrum of how we've been in terms of our case numbers, our totals, our vaccination numbers, and where we are in terms of each county and region. At the same time, the cdc.gov also provides that same information, and then it takes a wide scale view and then snaps it down to a more local to our particular area. And that's where I speak to this idea that our numbers have gone up. So when we're looking at a scale of how we are right now in terms of, in reference to everyone else, there is this idea of a low, moderate, substantial, and then high risk. So unfortunately for the state of Michigan, we are considered right now high risk. Now, that is this is me summarizing what you actually see on those actual websites. So it's this idea that we're high risk population because we have such a high percentage of positivity. So that goes back to what I was saying before, the idea being that we want to be less than 10% positivity. That means everyone that's coming to get tested, of those individuals, how many of them are actually positive? So if we have a high number of people coming in, getting tested, and then of those people are actually becoming positive, that makes us have a high rate. And at the same time, if those patients are symptomatic, they're increasing the number of people in our hospital systems. So that's where this idea of 77% of our hospitals in the state, not necessarily in to say that we're at 77% capacity where we're almost full, but it's 77% of our, as a state, of our patients that are that are hospitalized now that represent our COVID patients, unfortunately. And that is not to say that that 77% are those that are dying, but because this is a pandemic and those people are sick, this speaks to this idea of waiting until it reaches your door to say, you know what, let me do something about it. And it is important that we take this conversation that we're having here, as well as any other panel discussions, and taking heed to what we're hearing and why it is so imperative to immunize. It goes to that point in terms of how we look now compared to where we were April of 2020. We're unfortunately quite the same in the sense that our percent is high. Now, our death rate is not as rapid as it was in April of 2020, but unfortunately, because of the variants, we are still seeing a high number. And it is attributed to, again, as this idea of fatigue, as well as us being less restricted as we were in April of 2020. And then us not being able to understand the importance of vaccination and what that means, and being able to dismantle some of the myths behind it, and appreciate the transparency that we are seeing now. A lot of the discussions in terms of public health has always happened. It's just that now, because this is a pandemic, it's more on a wider scale. So we need to listen, and particularly listen to those that are taking the time to actually study and are credible sources. So those are the two that I speak from.
Thank you again, Dr. Evans. And you mentioned getting the vaccine, and that is where we're going to segue to next. Our next question is for Dr. Letitia Carter-Blanks. What strategies have been incorporated to achieve higher vaccination rates among vaccine hesitant people, and what barriers need to be overcome for the most equitable vaccine distribution strategy? We've seen in the news certain things such as more vaccination sites opening locally in the communities, even the city of Detroit offering incentives to help bring people to get vaccinated. So what are some of the strategies that need to be done to make vaccine distribution equitable?
Oh, yes, thank you. Good morning. So there have been many advertising campaigns, as well as forums similar to what we're having today, that are addressing these issues. These platforms have been throughout social media, throughout local media as well, to encourage individuals to become vaccinated. One of the most important strategies I think that we need to lean on is one that Dr. Evans touched on briefly at the end of her last question, and that's trusted stakeholders, right? So individuals in your community that you can trust. So your faith leaders, doctors and nurses in your community, other members of your family who may have been vaccinated, people that you have strong trust and belief in. Those are the people that you need to be reaching out to get those answers to those questions that you have, and really participating in forums such as these, and listening to the responses that are being provided, and taking that information and utilizing it to see how it best fits your needs as a community member. And I'm going to use Detroit as an example because I'm a native Detroiter, and I really think that the city of Detroit, of all urban cities throughout the country, they're doing a very good job in trying to make sure that there's equitable access to vaccine in that community. There are many barriers to access, one big one including transportation, Another big one, including homeless population and indigent population who may be a little bit more transient and more difficult to locate those individuals. But there are activities in the community such as the mobile Salvation Army bed and bread truck, which is also operating now in the city of Detroit as a mobile vaccine unit. So the mobile Salvation Army bed and bread truck goes out into the community each day, into the neighborhoods, and they're able to provide a hot meal, as well as their nurses that are on the truck that discuss vaccines, and they're able to offer vaccines to individuals in the community right at that moment. Ms. Henry spoke about the incentive program that is being offered to residents of the city of Detroit who have transportation to bring other individuals in to get vaccinated. And I think that's an excellent program, an excellent incentive. And that's a $50 prepaid debit card that if you sign up as a good neighbor in the city of Detroit through a pre-registration program and you bring residents of Detroit to get vaccinated, you'll receive a $50 prepaid debit card. And there is no limit on that. So if you bring 10 people, you're gonna get 10 gift cards. So that's an important resource. But what I also want to touch on is somewhat of the lack of the trust of the medical community, especially among people of color, and how some of these incentive programs can feel like coercion to them. So we need to also make sure that we address those issues as we talk about incentive programs. The most important thing is also making sure that there are enough sites within the areas. And currently there are several programs that are opening other sites. Within the city of Detroit, you can also go on the Detroit website, City of Detroit website, and request to be a site for vaccine distribution, and they can help set that up for you.
Thank you, Dr. Carter Blanks. The next question is for Dr. Evans. What are the short and long-term targets for achieving optimal herd immunity? We hear that phrase in the buzzword, but achieving optimal herd immunity, nationally and locally. And can we truly reach 75% herd immunity by the end of the summer?
I wouldn't say by the end of the summer. I think we do have some time to get there. And it goes back to what Dr. Blanks is talking about in terms of us understanding the importance of, getting the resources where the resources are not being able to easily and freely get there. This idea that we have this two arms of the spectrum, one being those that are hesitant, and then you have those that have the difficulty of actually access, our vulnerable populations. Currently, like one in every third elderly person that's not necessarily nursing home bound, but housebound, have the challenge of actually receiving the vaccine. So that is a particular vulnerable population in spite of the vaccine hesitant populations. But when we're talking about this term, herd immunity, I always like to stress we will get there one way or another. And unfortunately, when I say one way or another, is that idea that as the pandemic continues, sacrifices will be made, lives will be lost. And that is the idea of gaining herd immunity, either immunized or you have been exposed. And unfortunately, your exposure being a form of complication or disease severity or extended disease course. And that is one way of gaining it. But this idea of us being immunized is a more positive way of doing so, because as you have more people immunized, that prevents the virus from replicating and changing into something new, or actually being able to go from one person to another. That is how the virus grows. And the more immunized individuals you have, the less capability that actual virus has to grow and develop. And at the same time, with that increase in number of immunized individuals, this greater than 75% or idea of the US being 80% immunized, that means that in spite of those individuals that are strong, I am an anti-vax person, I do not believe in vaccinations, we will gain immunity in the country. But that is twofold though, because if in one hand we have only right now for the state of Michigan and as well for the US, it actually is meeting that mark. We're at a 24% population that is considered fully immunized. That means either Pfizer or Moderna having both both doses and 14 days out, or having the Johnson & Johnson and again, 14 days out from that immunization, where we are only 20% of the population. So that means if we kept with that number, then the population will still get coronavirus run through its entirety. And again, it leads to, well, who will survive in that? In February of 2022, that was our landmark of having, February the 22nd of 2021 is where we met our landmark of having over 500,000 individuals that have died. And that is a comparison to all three world wars that we have had combined. And that speaks volumes. To hit 100,000 individuals dying from a virus it's unheard of. And it's a historic moment that we don't want to get to, but we are unfortunately heading in that direction if we can't get enough people immunized.
Thank you again, Dr. Evans. The next question is for Tamar Pleasant McSwain. I hope I said that correctly. As a community leader and national program director for case management of Ascension, what is your advice to encourage people of color to get the vaccine?
Thank you, Latoya, and the physician experts just laid it out clearly in regards to the clinical and the scientific data that supports it, but I want to take it at a different angle. As a nurse case manager, a lot of the times we're the ones that are having these crucial conversations with families in the crisis, right? We're the ones that's trying to help them sort out decision making. And the worst time ever is to try to make crucial decisions in your life in a crisis, right? So I always stress to consumers and patients, prevention. And the best way that our experts have laid out to us is immunization. Get your vaccination. And you know, I've even talked to people who don't believe in vaccinations. They've decided to take the change because we're in a public emergency. This is a global crisis impacting every spectrum of that we can think of in our daily way of life. So I always look at them to say, have these preventative conversations, these crucial conversations with who you trust as your healthcare provider before you get sick, before your loved ones are impacted. Because once you are admitted to a hospital in an acute care setting, that's where the sickest of the sick patients are. Those are the times where you're in emotional crisis, spiritual, physical. That is the worst time to make decisions. You can't be there for your family members right now to help them make decisions. So have those conversations with your loved ones, with your healthcare partners before, so you can get all those those questions answered when you are not in a crisis. I can't stress that enough. And run from the misinformation that's out there. So a lot of times we gravitate to that, especially with social media and all of the one-liners to scare people off. You really need to do your due diligence and make sure that you're asking questions to people you trust in healthcare. And if you need to talk to a healthcare provider that looks like you, do that. You know, with Ascension, we try to stress that all the care that we provide is within our mission, vision, and values. And that is specifically focused on people in the vulnerable settings and people of color. So, you know, if you need to speak to a healthcare provider that looks like you, that you can trust, ask questions. Don't be shy. Advocate for yourself. And the best way to advocate for yourself is to get immunized. And I say this, you can't not get immunized and then still go visit your grandmother and put her at risk, and go see your grandchildren and put them at risk. You know, there's decisions that you have to make. And I always tell people, make scientific or try to weigh those pros and cons out, and make sure that you're looking at all the risks behind that. Cost is one. We don't like to talk about cost, but the highest level of healthcare in an acute care setting is the most costly. That's where you're going to get the abundance of your deductibles and all of those things, racking up the healthcare bills. So, you know, the more risk we take and not do preventative measures to protect ourselves and our loved ones, that you have to face the cost behind it. Funeral costs, medication costs. So not just your hospitalization, a lot of people are having after effects of having COVID, right? They're having respiratory issues that they didn't have before. They have to purchase inhalers, which are very expensive. So I tell people, you know, once you weigh it out, the risk of getting the vaccine is way less than getting the virus. And if you look at it from job loss, again, all the expenses that come with having to get medications and being hospitalized and being without your loved ones, you have to ask yourself, are you willing to take those types of risks?
Thank you. That was very important information. And if I just may add, truly can speak to what it costs to have the after effects. I'm a COVID-19 survivor, and I have been diagnosed with asthma. Never had asthma before. So you are definitely correct on weighing the pros and cons. Thank you again. Dr. Chris Purnell, can you provide us with some evidence that people of color, and specifically African Americans, were represented in clinical trials for the vaccine development, as well as being part of the research teams developing the COVID-19 vaccine?
Sure, great question. So let me first start with a little bit of my personal story as I explain why it's so important to have equity realized even in the process of clinical research, and to lead with equity and not to react with equity. Statistics say that Black women are 2.5 times more likely to know someone who has died of coronavirus. I lost my father during this pandemic. I lost my father at a time where the epicenter of this pandemic had landed in New Jersey, New York and New Jersey back in March and April of 2020. And I described to people that the epicenter landed on me personally, working and leading in one hospital. My father, my beloved father, a Black man who had overcome the Jim Crow South and had gone on to survive through a host of chronic health conditions, got hospitalized for something unrelated, got exposed to coronavirus, and died. I've subsequently have lost 2 cousins to coronavirus. So I've lost 3 people in my family to coronavirus. One of my cousins was a Newark postal worker. So again, someone who worked in a central role and continually had access with the public. In addition to those that I've lost in the most severe sense of the term, my sister, a breast cancer survivor, is a COVID-19 long hauler and can identify a lot with what you are describing, right? Those chronic, debilitating impacts and effects of the infection. So with the complexity and the comprehensive nature of everything that I experienced, and being a public health physician and believing deeply in public health science and seeing Black and brown patients filling my hospital, I needed a way to be a part of the solution. I needed a way to help to beat back the pandemic. And so I enrolled in the Moderna COVID-19 vaccine trial. I was one of the approximate 30,000. Moderna ultimately had about 10% representation comprised of African Americans in its trial. Pfizer had about 9%, very similarly. Johnson & Johnson similarly had about 10 and or higher. If you look at Latino or Latinx representation, similarly, you see whether the trials were done globally on the case of Pfizer and J&J, or trials were done domestically. You saw at least 10 to 13% and higher. In Moderna, was roughly about 20% representation of Latinos. It was not only important to have diverse race and ethnicity representation. And that's not because race is biological. That's because we need to ensure that persons in their conditions and environments in which they live, that the vaccines would be demonstrated to be effective. The term that we use in the clinical research trial is efficacy, but in the real world scenario, it's effectiveness, that these vaccines would be effective at preventing severe disease, so effective at preventing hospitalization, stay in a critical care unit in the hospital, and preventive of death, as well as safe. And so knowing that we were represented across those trials at numbers that were higher than Black and brown participation has been historically in clinical research is very important. Moderna even slowed down its trial. Moderna was on track to probably apply for emergency use authorization, the EUA, before Pfizer, but Moderna had not achieved its diversity and equity goals. So it slowed down its trial and doubled down in diverse communities communities to ensure that adequate representation so that the results would be generalizable, so that we can say in all Americans that this tool, this preventive tool, would be equally effective at preventing severe disease. And so I believe that we've had a serious measure of success. There are those who argue that the representation in the clinical trials should be more commensurate with the rates, the disproportionate rates of impact of coronavirus, meaning how many people have been hospitalized or died because of coronavirus, and not just because of your population share. We're not there yet, but we had a very aggressive outcome around representation. But I also want people to know that that representation wasn't just in race and ethnicity, that representation wasn't just across gender and sex, but that representation was across chronic health conditions. We had people participating in the trials, whether in the Moderna trial specifically, and the others, which had similar numbers, at rates of about 20% and above. That is very important. Again, this allowed clinical researchers to say that in those with chronic health conditions like high blood pressure, like heart disease, and even some autoimmune disorders, those with chronic HIV infection participated in the trial. Those with diabetes participated in the trial, and the vaccine were proven to be safe, meaning the safety profile, the side effect profile was similar as seen across all groups, and they were proven to be effective. I think it's very important for people to know that. I can tell you in our community in Newark, when we were announced as a site where one of the studies would be held, we did encounter some consternation. We did encounter some suspicion of were Blacks being targeted. No, Blacks weren't being targeted in these trials. Urban areas weren't being targeted, but Blacks were a part of the imperative to create diverse representation. There's a difference. In Moderna, for instance, there were over 90 trial sites across the United States representing the diversity of race and ethnic populations, representing the geographic diversity in the country. And that is what we need to achieve across the board when we do clinical research. So that's very important. And then to your last point, it's very important that our community knows that, yes, we have been disproportionately impacted. Yes, earthquakes of devastation because of systemic racism and this unprecedented public health crisis have burden our communities in particular, but we also have been at the table of discovery. Dr. Kizzmekia Corbett, working with her team and helping to design the genetic sequencing that's just not in Moderna, truthfully, that is in all of the vaccine candidates that are under EUA right now. Not only were Blacks involved in the investigatory process, but Blacks were involved in the FDA process, the independent advisory panels that examine the data of drug companies to ensure that, no corners were cut. And I have to say that and emphasize this, because this is something you can imagine that all of us across this panel, and myself in particular, I talk about every night, whether it's through a virtual audience or through my phone, a phone call or a text, or talking to someone in community. I was running here literally this morning from a community vaccination event that we're doing in Newark for walk-ins to get people vaccinated. So it's important for people to understand that we not only had a seat at the table, we were designing the table. And this has to become the baseline from which we operate and go forward, because you cannot respond with equity. You must lead with equity. And the last thing that I will say is this was truly an example of smart government involvement. When the government removes barriers so that science can happen in an efficient and effective process, we can save lives. So if we can imagine a scenario where we can do this for other crises that are devastating Black and Brown communities, then we can not only achieve and lead with equity, but we can make the leaning tree upright and achieve health justice.
Thank you. Thank you so much, Dr. Purnell, for that answer. I just want to say to all of our panelists, we have about 25 minutes left and still quite a few questions. So we are going to try to get through as much as possible because we do want to take the time to take a few of the questions from those who are watching. So the next question is for Dr. Carter Blanks. At this point, who is eligible to receive the vaccine, and where can the community find COVID-19 vaccine information? And are there still waiting lists? And if so, how can they get on the waiting list?
Great question. So right now, Pfizer is available to any individuals age 16 and above. The Moderna vaccine is currently available to any individuals 18 and above. Johnson & Johnson is for individuals 18 and above. However, right now they have put a pause on on distributing the Johnson & Johnson vaccine due to the blood clots that they were seeing in a small subset of women who had received that vaccine. So unfortunately, the FDA has put a slight hold on that vaccine. And I am a big believer in one-stop shopping. And so for one-stop shopping, for those who have access to the internet, I would refer them to vaccines.gov, which is run through Vaccine Finder. And those individuals you will be able to put in your zip code, and they will give you vaccination sites within a certain mile radius of your zip code. And then you can select the vaccine sites from those areas in order to find one that's conveniently located to yourself. For those who do not have access to the internet in the state of Michigan, there is a local number that you can call, which is 1-800-535-6136. And you can get that information by pressing 1, and then they can help connect you to vaccine sites in your area. The word on the street, and this is not any official word, but this is information that I've received through some pediatric groups that I'm currently involved in, is that they will be shortly expanding the emergency use authorization for the Pfizer vaccine to include children ages 12 to 15. And so that will open up that opportunity for some of those middle school and younger high school age kids to hopefully receive the vaccine before the next school year.
Okay.
Oh, and it looks like as of April 27th, Johnson & Johnson is now back in use, which I was not aware of. So I missed that in my busy week this week.
Thank you. I was getting ready. I could tell that someone was ready to chime in. Dr. Evans is ready to chime in on that point. So thank you. Thank you. The next question is for Dr. Purnell. What are the most common side effects and complications from the vaccine to date? And do they tend to occur with the first or second dose for the 2-dose vaccines? Or what if someone is like me who had no side effects from getting the vaccine at all? Does that mean anything in particular?
Great question. I don't have my home computer, but if I did, I would share this graphic that breaks this down fabulously, one of the best that I've seen. But in summary, the side effects that are most commonly experienced, if you think about side effects, think about local side effects and think about systemic side effects. Local side effects, pain and tenderness at injection site, not much different from when you get any of your vaccines, whether it's flu, whether it's pneumovax, whether it's tetanus, whether it's shingles or anything of that nature. Overwhelmingly, that is the most common symptom that is reported. After pain or tenderness at injection site, you have reporting around a generalized system, a systemic symptom of fatigue. Not quite a majority, but still a fair amount of those who receive the vaccine do report fatigue. Fatigue is usually reported more after the second dose than the first dose, but it can be experienced with both shots. I can tell you in my scenario, I didn't know at the time whether or not I had received placebo or if I had actually received the vaccine. I found out once I was unblinded because I'm a healthcare worker. I was presented with the opportunity to be vaccinated. Therefore, Moderna made the choice to unblind all participants. I got really fatigued, like literally I couldn't get out of my car, and not the normal, you can't get out of your car and you're sitting there for 10, 15 minutes. It's like I felt floored, or as my mom used to say, I felt like an fatigue. You can also experience fever and or chills. or generalized body aches. That's rarer, maybe anywhere if you look at numbers sometimes in the high teens to 20% or even less in the single digits have experienced anywhere from the fever, the chill, and the generalized body aches. And again, those are normal. I want everyone to understand that side effects are routine expressions of your body, meaning your inflammatory response because your immune system is working. Side effects are different from adverse reactions. Adverse reactions are typically are those allergic reactions that you may see. It is considered an immediate allergic response or adverse reaction if it happens within 4 hours of administration of the dose. And if you do have an immediate allergic response in a 2-dose series vaccine, so both Moderna and Pfizer, it is recommended that you don't get the second dose. And the last thing that I will say, in J&J, we saw very serious adverse reactions in a very narrow and rare subset of the population. To date, there has been about 15 or so cases of blood clots in the brain, which have been coupled with low platelet counts. And that's a distinguishing feature because that means that treatment would be different. They were mainly in women, although there is a case report of this happening in a man recently. And it was over 8 million doses administered. So the risk is substantially low.
Thank you, Dr. Purnell. Tamar, how much does the vaccine cost, and are there any vaccine administration costs?
Very good question. And the answer to both of those is no and no. No, there is no cost. Free, free, free. So again, prevention is usually your lowest cost. A lot of preventive measures are offered to our community at no charge. And back to what Dr. Purnell and Dr. Evans were talking about, to make sure that we have access to health care. And in this situation, I tell people, we now have access to health care. We are a part of the clinical trials. We're at the table. And so compared to medications we take every day, there are side effects, but we weren't a part of a lot of those clinical trials to test out those medications that we take each and every day. But we're quick to trust things that we don't even look, we don't do our research, but we'll put it in our mouth. If it'll make us lose weight, we'll take it. So yeah, we got to make sure that we are weighing these out, making good decisions based on the science, based on having conversations with credible sources and not fear. And of course, we want to not minimize the fear, but also want you to just take a deep breath and try to understand, where is this fear rooted? What is it coming from? Because the mental toll of keeping up with all of the healthcare costs that come along with chronic illnesses, it can weigh out much differently if you just take those preventative measures and take charge of your health care and try to make good decisions up front before those things happen. So long story short, there are no costs to the administration or the vaccine itself. Thank you.
Thank you. The next question, we're going to move to Congresswoman Lawrence. And we want to talk about the guidelines that have been put out by the Centers for Disease Control. That just this week, they have updated the guidelines. So do we still need to follow the precautions after getting the vaccine, masking, social distancing, frequent hand washing, and or hand sanitizer? And if we are following these guidelines, does this mean that the vaccine is not completely effective?
I want to thank everyone for being here, the amazing doctors that we've heard from and healthcare providers. I want you to know there is an intersection between healthcare in America and government. And we as Deltas, we understand that our social action to get the right administration in, it has been a tremendous difference from what we have seen with the administration that's currently in place with guiding us through this pandemic. Yes, the CDC has laid out guidelines and we are required to follow those guidelines. Washing your hands should be a norm wherever, I mean, whether there's a pandemic or not. So there should not even be a discussion about that. Wearing the mask is an additional barrier. And I'm sure my state rep, Weiss, is going to talk about this. But the governor has started a vaccine to normal challenge that put landmarks in place for us to be able to remove our masks. I support the governor 100%. And I know that time is short. I just really want to elaborate on the federal level perspective on the fight that we have in government to fight COVID-19. And that is $130 billion for K through 12 schools, 9.3 million for health centers in Michigan, the community health centers, 39 billion for childcare. The Ford Field mass vaccination centers because of the American Rescue Plan that put dollars in pockets, monies for restaurants and small businesses. We would not have that mass vaccination center if it was not for passing the American Rescue Plan. And I'm excited to say that today I'm starting with these amazing partners throughout our community, which includes Delta Sigma Theta, Myers, Empowerment Church, Wayne, Oakland County, the City of Detroit, cities of Southfield, Oak Park, Zeta Phi Beta, Omega Phi Psi, Henry Ford Health Systems, Beaumont, and Ascension. We are all partnering together to have a no registration walk up. We're leading up to Mother's Day. And if you love your mother, you know she loves you, give the gift of the vaccine. We're removing the barrier of registration, which some people say is a barrier. We are opening it up to you don't have to register, just walk in. It'll be for 7 days and it'll be open, and you can go to my website, and that is to find out how you can go to one of these sites. I'm just so impressed with the doctors who have the research to debunk that myth. And I'm also impressed with the doctors who are doing the care. And so for all my Delta Sigma Theta sisters, we have a lot of work to do. And you can go to my website at lawrence.house.gov and follow my social media to find the sites that you can just walk up to, no questions asked, free, get your shot. And thank you so much.
Thank you. Thank you very much, Congresswoman Lawrence, for that information and breaking news to help people be able to get vaccinated. We're going to go to Dr. Carter Blanks. And the next question is, will the vaccine be effective if you've already been diagnosed with COVID-19? And should a person who has been infected with COVID-19, do they even need to bother to get vaccinated?
That's an amazing question and very important question, and one that people have a lot of confusion about, but the answer is yes. Because we don't yet know how long antibodies will last in your body, and that's whether you actually had coronavirus or you built antibodies because you received the vaccine. And so it's imperative that even if you had wild type, as we call it in the medical sector, coronavirus illness, then you should still receive the vaccine. And it is still safe and effective for you to receive the vaccine. Now, what we have seen is that some individuals who did have coronavirus, they did have a few coronavirus-like symptoms after receiving the vaccine. And those are things that are to be expected, right? Because it's your body recognizing, yes, this is something that you're giving it. It recognizes it as foreign. And it's like, okay, I'm going to work to make sure that I don't develop illness from this. So those are things that we are expecting. So mild fever, maybe even a little bit of a cough, cold, runny nose. Those things may be expected in somebody who has had wild type coronavirus who has received the vaccine. There are currently studies that are being conducted to help us sort of understand how long antibodies are going to be lasting in our system. And if we're going to be needing booster vaccines of coronavirus in the future. I'm actually currently enrolled in one of those studies right now through the University of Michigan. So hopefully in the next year or so, we'll have more information. What we do know for the past 6 months, it looks like those antibodies are at least lasting that long, but that's only the time slot of data that we have to offer at this point. So
the short and long to that question is yes, yes, and yes, you should still receive your vaccine.
Thank you, Dr. Carter Blanks. The next question is for Representative Wise. Why should we trust the CDC and the information and recommendations regarding the pandemic and getting the vaccine, especially since wearing masks and some of the other preventative measures suggested have become so politicized?
The
Yes.
CDC, go ahead.
Oh no, Congresswoman, do you wanna take a first?
No,
stab at it?
go.
And you can build into anything that I missed. First of all, I just want to thank you so much for inviting me to speak, and I want to thank every single panelist. It's been wonderful listening to these amazing experts share their expertise and their experience and why this process is so important and what we can do to protect each other. You know, as I'm sure everyone on this panel will agree with me, yes, these things have become politicized, but science is not political. Science is science. It's based in fact, it's based in reality, it's based on research and hard work by very many talented people across our country, including the panelists on this call today. And while unfortunately, some of that information has been used politically as ways to attack political opponents, we've seen that, for example, in Michigan, that some of the COVID restrictions were used to attack our governor and used to attack our Democratic members of the legislature. Just a year ago yesterday, we had a storm on our Capitol in Michigan with armed militiamen that many saw, but in many ways was a precursor to the January 6th insurrection. And that largely was in response to COVID restrictions that were put in place by experts to keep us all safe. I believe Tamar mentioned there is a lot of misinformation that is thrown around to try as an attempt to confuse people and honestly, in an attempt to manipulate people for political gain, which is unacceptable. And so I think it's really critically important that we listen to our public health experts, that we listen to our medical experts and our scientists, and respect their expertise and their opinions, and make sure we seek out credible advice and credible resources in making these critical health decisions. And you know, and also as far as the CDC goes, a lot of these guidelines were put in place under the Trump administration and were also carried forward under the Biden administration. So again, the scientists are not political. It's the way in which the scientists are attacked and the way in which that information is misinterpreted and misrepresented that becomes political. And I don't know if Congresswoman, if you want to add on to that.
The comment I want to make, you made, science is not political. All of our trained medical professionals here, they had to embrace science, challenge science, and validate through science. And so this is where we are. And it breaks my heart that there were some movements to politicize the vaccine, even the virus, as if you're immune if you're a certain party. And now there's some party identification when it comes to the vaccine. But we will collectively move through this as we see the virus does not care what your card-carrying political party is. It is a human issue, and we must attack it that way. Thank you.
Thank you, Congresswoman Lawrence and Representative Weiss. The next question, Dr. Evans, and it's actually a question that people ask me from having COVID, but what's the likelihood that a person can get reinfected with COVID-19 after the recommended and timely doses of the vaccine?
It's still roughly high. The vaccine is not 100% effective for preventing you from acquiring the virus itself. The vaccine's efficacy right now is 95% effective for both Moderna and Pfizer, and just a little over 68% for Johnson & Johnson. And then we have the unfortunate things of the variants. So you can still get the virus in spite of being vaccinated. Yes, for sure. The purpose of being vaccinated was to prevent hospitalization and disease severity. That was the purpose of our vaccines, and that's why they're here. And at the same time, it goes to the point of us getting to a place of herd immunity where we have enough immunized individuals that the virus cannot change into something else. So yes, you can be reinfected. And it goes to the climate in which you live as well. Like I was saying before, the transmissibility. Right now, the state of Michigan is what's considered high transmissibility in comparison to other regions and places that are at the lowest low versus moderate versus substantial. And in our unfortunate state right now is high transmissibility. So that speaks a lot about the need to continue to do our passive immune things, which is wearing our masks.
Dr. Evans, you froze a little bit. I think the last part that I heard was still wearing your mask, and then you broke up just a little bit.
I apologize. I'm seeing that my signal is going in and out right now. So basically, yes, you can be infected with coronavirus in spite being vaccinated. But the purpose of being vaccinated is for you to understand that we're reducing disease severity and we're reducing hospitalizations. So it is still important for us to get to a place where enough of us is immunized that we don't spread and we can reduce transmissibility. But unfortunately, right now, particularly for our state, we are still at a high transmitting rate. So that means that we do need to continue to do the important measures in terms of wearing our mask and social distancing, especially when you don't know if the person next to you is vaccinated or not. It's different than you being in a climate where you can account for your peers or your family members being vaccinated. But when you're out in the public, you should still be mindful of the fact that everyone may not share the same values and practice the same way of keeping each other safe.
Thank you, Dr. Evans. Dr. Purnell, my next question has a really big word, and I'm going to need you to break it down just as you did efficacy. Is the vaccine contraindicated if you have chronic diseases such as high blood pressure, diabetes, and heart disease?
No. Actually, if you have chronic health conditions like the conditions that you just mentioned, it is strongly encouraged for you to be vaccinated because your risk of worse outcomes with coronavirus is higher. I myself, I have several chronic health conditions. One in and of itself is immune mediated. So I was very thankful that I made it through the screening and I was able to participate in the clinical research trial and I'm a person, I live off of medication. I wake up every morning and I take multiple pills to make this body work. So I think that is important for me as a physician to be able to share that story and to share that story in community that yes, if you have a chronic health condition, whether it's high blood pressure, whether it's heart disease, whether it's a neurological impairment, whether it's diabetes, whether it's asthma, whether it is autoimmune. I think this is a really difficult topic for patients with autoimmune disease. I have a cousin who has lupus, and so her doctor has been in a back and forth conversation with her. And this is an example of shared decision making. And he has a specific window of when he wanted her to get vaccinated as it related to her clinical presentation, but there is no blanket contraindication, meaning absolutely no for any chronic health condition. Even if you speak with, those doctors who treat people who have cancer and who are going through chemotherapy regimens, they'll tell you that those patients too should get vaccinated, although they may determine which is the best window of time to get vaccinated. So it's going to be very important to have that conversation with your individual doctor. This is an example of shared decision making, but there is no blanket contraindication. Actually, it's encouraged.
Thank you, Dr. Purnell. And panelists, I just want you to know we're doing great on time. We're rounding the corner. We just have a few more questions left. The next question is for Dr. Carter Blanks. Is there any data from the current clinical trials about the vaccine for pregnant women, lactating mothers, and you already mentioned children under the age of 16, but what about those who may be expecting or who have already given birth?
Yes. So there is data out there, and the American College of Obstetrics and Gynecology, as well as the American Academy of Pediatrics, of which I am a current board member for the state of Michigan, highly recommends that unless there is another contraindication for a pregnant or lactating woman to receive the vaccine, such as a previous reaction to a component of the vaccine, they are safe to receive the COVID-19 vaccine in pregnancy as well as in breastfeeding. And there has not been any evidence to suggest that it will increase any risk to the pregnancy or to the lactating mother or the infant that is receiving that breast milk from the mother. And so it is highly encouraged that unless you've had a previous reaction, as Dr. Purnell spoke about regarding reactions to vaccines, to a component of that vaccine, then there is no contraindication for pregnant or lactating women to receive the vaccine.
Thank you. Thank you, Dr. Carter Blanks. And Dr. Purnell, what about taking acetaminophen or ibuprofen before or after the vaccine injection? Is that recommended?
It's not recommended that you take it before your injection. So I just want to be very plain for people. Acetaminophen, which is also known in the brand name of Tylenol, ibuprofen, which is known as, Motrin, Advil, or even Aleve, naproxen. It's not recommended that you take any of those non-steroidal anti-inflammatories before your injection. If because you're experiencing pain or you're experiencing some of the other side effects like fever or chills or headache, you can take them after your injection.
Thank you. This is a two-part question for Congresswoman Lawrence and State Representative Wise. Can you elaborate, and Congresswoman Lawrence, you started on this, but can you elaborate more on things that are happening on the federal level and for Rep Wise on the state level? What is being done to reassure our communities about the current crisis that we are in?
I am proud to say that I am on the executive board of the Black Caucus in Congress, and actually went to the White House as part of the leadership to sit down with the president to talk about the state of Black America's health. And I really appreciate Dr. Evans and Dr. Purnell being so clear in this just dismissive attitude. Well, Black people die more because they have more health issues. So there are some things on the federal level. We have to get to the core of our illness, healthcare in America, systemic racism, almost every area of chronic illness. Black people lead the pack, and Black women are the most impacted. Maternal mortality, we're the highest in the world in the United States, and Black women lead the pack in that. When it comes to breast cancer, prostate cancer, when it comes to the number of us being infected with diabetes and other issues. So we have to, and I told the president, I said, I have a firm policy. Do not tell me what the problem is more than one time, because once you can articulate and identify the problem, then we need to start working to fix it. And so having, and I know the doctors can go into this, there's so many issues leading to our chronic illness. Food deserts, our children, our pediatrician is on here, not getting access to food that will help them to develop into a healthy adult. Having access to healthcare. Telemedicine is going to be a huge game player, and we've had to just dive into that with COVID. Having those community health centers in the community where people can go and get the healthcare they need. The science. So often, and Dr. Purnell, thank you so much, because so often we are left out of the trials and the research. And so for him to fund NIH and make sure that we are doing more research, why haven't we found, you heard in his address to the joint session, Why haven't we found a cure to cancer? Why have we not invested in that? Why are we still walking around with people losing limbs from diabetes? I mean, these are things that the government has a major role to play here. And then having the respect of science. And unfortunately, and I know that social action, we're supposed to be all about the vote and don't get into the partisanship, but I have to speak truth to power. We had an administration that did not embrace science and encouraged on a political level not to embrace it. We now have the opportunity with the amazing team of doctors that you see here, just this panel to really take away from, and I'm very conscious that I'm directing my people, get the shot. One of my major friends who's a doctor, he said, Brenda, had you got your shot? Because they were pulling in we were considered first responders, so they were getting all the members vaccinated. I'm gonna wait. Something may happen. He said, what can happen? He said, well, I might get sick. He said, Brenda, sick, dead, sick, dead. He said, I can fix sick, I can't fix dead. Get the doggone vaccine. I need you. And this is the message for all of the people who are listening. If we are sick, incapacitated, hospitalized, where is our brilliance? Where is our ability to take care of our families? Where is our ability to fight for justice? Where are those things? Because if you're sick, you're not helping anyone. I need my Black community strong and healthy, and get off social media. And I tell you that we have an opportunity, and that's why I'm working hard to have this vaccine week, that we can make a difference. And I'll turn it over to Regina. Thank you.
Thank you, Congresswoman. So well said. I really want to thank Congresswoman Lawrence and her leadership at the federal level and her work, as well as the rest of our congressional and Senate delegation and our president and vice president in getting the American Rescue Plan Act passed, in getting these essential dollars to our states and local communities and school districts to help with the relief that we need immediately, to get vaccines and shots in arms, to build education resources around the importance of vaccine, and to provide essential relief to working people and families in school districts who need that support immediately. And it's been a huge benefit here in Michigan, and I just really appreciate your leadership on that. At the state level, many of those dollars come through our appropriations. And I don't know how closely anyone on this call follows the state appropriations process, but it is a very political process. And I have the pleasure of serving on the House Appropriations Committee, and I am the ranking Democrat on the School Aid Subcommittee. And we have been working on trying to get this money out. Unfortunately, the first round of stimulus funding from December, much of that funding was held back. Funding that was essentially needed, especially funding for our schools. $841 million in relief for our schools was held back as a political tool against the governor. And so we've been fighting and negotiating in Lansing to try to get these dollars out. We recently did pass through our House Appropriations Committee a new supplemental budget that would get out the remaining dollars from December, as well as all of the American Rescue Plan dollars. We're still working and negotiating to make sure that those dollars are spent in the best way possible, and not just as corporate handouts, but are actually going to help working families and communities and school districts who need that relief immediately. So we are working on that really hard in Lansing right now, just to give you an update. And then also, and I'm sure everyone is familiar with, our governors just recently, and our Michigan Department of Health and Human Services has just recently announced our Back to Normal plan, which is a way that we can get back to normal through vaccination. So everything that we're talking about here, everything that was said about how critically important vaccinations are for our own health and our public health and the health of our loved ones in our communities is so true. And it is also an essential tool to getting back to some semblance of normalcy, where we can go to restaurants again, go to concerts again, meet, go to large church gatherings, meet together in public and feel safe and secure. And so that is being tied in Michigan to our vaccination rates. So right now we're at about 50% of Michiganders have gotten their first shot. When we hit 55%, the lift on banning in-person work for folks who don't need to be in person is being lifted. Once we get to 55% plus 2 weeks after. So once we hit 55, 2 weeks after that, because that's when you're at full immunity, that's when that kicks in. Once we get to 60% first shot in arms plus 2 weeks, that means we're going to increase indoor capacity for sports stadiums up to 25%. And it's also going to increase indoor capacity at conference centers, banquet halls, funeral homes to 25%, and gyms to 50%. Once we get to 65% plus 2 weeks, it'll lift the number of all indoor percentage capacity limits, requiring only social distancing between parties, and relax limits on residential and social gathering. And then once we get to 70% plus 2 weeks, which is our biggest goal, hopefully we hit it and get beyond. There will be the lifting of all gathering restrictions and mask orders. And so that is what we're working towards. Now, all of that is also, and this is a very important note, this is all contingent on this being able to be done as quickly as possible, as was said, so that we can limit the spread and also limit the development of new variants. Unfortunately, new variants could possibly be more vaccine resistance, which could possibly cause us to have to move backwards on some of these plans. And so we're trying to move through this as quickly as possible. So the faster you get vaccinated, the faster you encourage your loved ones, neighbors, friends to get vaccinated, the faster we will all get to where we want to be.
Thank you, State Representative Weiss. And so we are at the point where we're getting to our last question, and I do want to pose it to Congresswoman Lawrence. You've shared a wealth of information today, and we know a lot of people in the community who would like to be helpful with the COVID-19 response team. And so is there any way that they may sign up and volunteer, or what can community members do to help us in this fight against COVID?
One of the ways it was outlined today, take a friend to get a vaccine. There are some people who don't have the luxury or the privilege of transportation. Getting your vaccine, number one, taking someone else to get the vaccine. Join me this week in encouraging other people, because we have to recognize that there is a directed campaign of misinformation to the Black community. And we are going to have to use our voices and be sophisticated enough to counter that. Don't just say, girl, that's not true, and just walk away. We need to get the facts. And so Dr. Pennell has had so much, the CDC, our own Michigan Department of Health has factual information. The other thing is that we need assistance at the sites for volunteers to give greetings, to hold a hand. I've had some volunteers tell me people will walk in scared to death and say, I know I need to do this, but I don't know if I want to do it. Just to hold their hand, listen to them. And so we've had volunteers to actually hold a hand all the way through the whole process with a stranger, just to give them some support. We also are asking for wheelchair assistant volunteers. Backgrounds in the medical field is a plus, but it's not required. Oakland County is looking for volunteers, and you can email EOC at oak.gov to volunteer at some of the sites. And then go on social media and share your positive vaccine story. We're hearing them today. Even the doctor has a story. Your story about being one of those people who stepped up during the trials. I have not heard anyone share that. You are very special, and you're a Black woman, and you're a doctor. I mean, that's just checking all the boxes. So share your stories on social media, and getting everyone vaccinated. I was told that we have 2 million vaccines sitting on the shelves that could be in arms right now. So I'm hoping this week and week after that and week after that, we'll continue. It's one person at a time. I don't care if you get that one person and just get you a cup of coffee and sit down and talk them through it, drive them to the site. But we need all hands on deck. Thank you.
Thank you so much, Congresswoman Lawrence, and thank you to our panelists. Outstanding job, very informative. I greatly appreciate that you all decided to collaborate and work with my beloved Southfield Alumni Chapter, and I'm just proud to be able to serve as moderator for this great event. And next, we will transition into questions from the chat to be able to answer some of the questions that the audience may have. And so I will now turn the program over to Felicia Marshall. And again, thank you, panelists. Awesome job.
Thank you to our esteemed panelists and also to our amazing moderator. We have learned such great valuable information today about the coronavirus, the pandemic updates, and the vaccine options. I thank you so much for taking the time to do this. We truly appreciate that. Truly, you have debunked myths, misinformation, disinformation. So thank you to all for doing this for us today. At this time, we would like to take a quick poll question in regards to the information you've learned today. It's either going to be yes or no. You've learned valuable information, so please, there you go. The poll is up now. Oh, wow. 100%. Great. Thank you so much. If we can get a screenshot of that, that would be nice. Thank you. We're going to end the polling. So at this time, we will go ahead. We have two questions that we can answer in reference to what was in the chat. There were two major questions that, the audience really wanted to know. The first question, I will direct this question to Dr. Evans, our infectious disease physician. They mentioned, the attendee said, what are the health outcomes if you only receive one dose out of the two doses from Moderna and Pfizer? There was mentioned from statistics that 64% effective if you only do one dose and 94% effective if you do two doses. So maybe you can elaborate and tell us if that is correct.
That is true. So this speaks to us worldwide because there are places outside of the US that unfortunately have only been able to receive one dose of either the Pfizer or Moderna or the other vaccines that have in those areas met their EUA or rollout time. And I say that because we're in a place, we are relatively blessed to have three different choices of vaccination immunization. But to your point, yes, receiving one dose, although the studies and the trials have alluded to when we're saying efficacy and prevention in disease severity, it was based on those two doses. But there is a level of immunity that comes with one dose, although we know that the best is having both doses when it comes to the Pfizer and Moderna vaccines.
Great, thank you so much. And the second question I have is actually, it's a two-part question. This will be for Dr. Carter Blanks and also for State Representative Regina Weiss. First is Representative Regina Weiss. Do you think that the governor will feel comfortable with schools starting full-time, no remote, no hybrid in the fall? And then to piggyback or to add to the response for Dr. Carter Blanks, are you comfortable being a pediatrician for children starting back in the fall?
Yeah, so I think that there are a lot of variables that are going to happen between now and then to determine whether or not we're going to have a full, safe complete return to face-to-face learning in the fall. I know that's what everyone is hoping for. Obviously, children when they're in person, when they're face-to-face, they learn the best. It helps relieve anxiety. It helps with other issues as well. And so that is definitely the goal. A lot of that is going to depend on our vaccination rates. At this point right now, children cannot be vaccinated. However, we are seeing, we saw this month the highest spike in pediatric hospitalizations of children with COVID-19. And so this is affecting children. They're impacted in terms of negative responses and severe responses and even death as much as older populations in general, but those cases still do exist. And unfortunately, with variants being what they are, and with the vaccine, with the virus being able to mutate and change, that could change as well. And so there's a lot that's still up in the air. But the best way we get to that point is by vaccinating as many people who are eligible, and that would include teenagers. I saw in the chat too, there was a question about teenagers being vaccinated, and I'm not a health expert, so I'll defer to the health experts on this one, but I will say as a former high school teacher, if they're eligible to be vaccinated, you should get those children vaccinated because social distancing is not their strong suit. So helping getting us back to face-to-face learning in the fall again is going to be critical depending on our vaccination rate. And it's really just a race against these variants at this point.
Thank you. And Dr. Carter-Blanks, your view?
Yes, I actually do feel relatively comfortable that children can attend face-to-face learning with mitigation strategies that are being put in place so that they can safely return to school. Being fully transparent, my own daughter has been in face-to-face school since school went back in September. Now, granted, she does go to a private school, so there are smaller class sizes. However, they still had significant amounts of mitigation strategies, such as making sure that they have surveillance, monitoring temperatures, keeping the students as safely distanced as possible. I'm also involved in an ABC School Collaborative, which is a collaborative that came out of Duke University in North Carolina, studying this issue about safe return to school and what implementation strategies we can use within the schools to make sure that students can safely return. And many schools and public schools in many municipalities in the state of North Carolina have been returning to school face-to-face, and they have not been seeing a significant spike in their coronavirus cases among those students that have been returning to school. The cases that we have been seeing within in students have been students who have gotten coronavirus outside of school. So the important thing to understand about return to school, it's about mitigating in-school transmission. So what you have to understand that if coronavirus is still circulating in your population, in your local municipalities, there will be students that have coronavirus at the school. However, the goal is to prevent that student from passing on coronavirus to other students. So making sure that we have good contact tracing protocols, making sure that they have good mitigation strategies and things to eliminate ill children from participating in in-person face-to-face school. So from a parent perspective, as well as a pediatric perspective, I do believe that students can safely return to school with certain mitigation strategies in place. And yes, we must work to make sure that our high schoolers who are eligible to receive the vaccine. And I'm prayerful that in the next 3 to 6 weeks or so, those middle school age kids will be able to receive the Pfizer component of the vaccine. And also they are in studies right now with Pfizer as well as Moderna for the 6 to 12 year age group, as well as the 6 months to 6 years age group. They're running in tandem, and hopefully those results will be available by the fall. So by maybe the end of this year, early next year, we'll be able to even immunize those daycare kids as well as those elementary students.
Wow, that's some good information. We didn't know that as reference to the kids 12 and under. We were all wanted to know about this. So thank you so much for that, both of you, in reference to answering to the question as far as the Q&A for the audience. That completes that portion, and now we'll do a second poll question, and that would be, would you attend a similar event or invite a friend to attend a similar event? Poll question. And this is also a yes or no. Thank you, audience. Appreciate it. Now, at this time, that concludes the panel discussion and also concludes the audience discussion Q&A. Thank you so much for attending this wonderful and powerful COVID-19 virtual town hall. I thank you so much for also attendees who took the time out on a Saturday to be with us and learn more about the updates on the coronavirus 19 pandemic and the vaccine treatment. Also, I do want to hand it over to our first Vice President of Southfield Alumni, Delta Sigma Theta. Her name is Venus Brown. Please welcome her. Thank you.
Thank you. And thank you for hanging in here for just a little bit longer. I know we went over our time just a little bit. You can't rush good information. Just like you said, you can't rush the science. So for all of you that stayed for this program, I just really want to thank you. You got your charge that each one of us can take this knowledge, it's power that you were given today. Each one, teach one, reach one. So that's your action. You take this, share it with someone else. At one point, there were 86 people on the line. So if each of us take even the 75 that are left, if each of you double this, right? You take it and you share it with someone else, and they share it with someone else. Now we're getting those numbers up. I think the representative mentioned we're trying to get past 50 so we can get back to normal, right? So we need you to share this information and to take action today. I absolutely want to just thank all of our esteemed panelists, of course, certainly our Congresswoman. Great to see you. Thank you for being here and sharing your knowledge and support. Your advocacy for all of us. We want to thank the state representative who had to leave, I think. We also want to thank all of the doctors. You all brought I see the state representative there. Yes, still. All of the knowledge that you brought. Thank you so much for sharing this afternoon with all of us. I ask that you members or participants, please go to the chat and download those links. Make sure you save them so that you have them for later. Please complete our evaluation. I know you participated in the poll, but complete the evaluation so we can continue to bring more events and topics like this forward. I want to thank the co-chairs of the ERT committee, both Aletha Jones and Felicia Marshall, for bringing this forward. The chair of social action, who could not be here this afternoon, but we thank her in her absence, Bridget Officer, and we thank those that follow.
She's muted.
I laid my hand on my book on my paper. We need you all here safe and not dead. I think our Congresswoman said we need you here safe. So please take heed to the information that was shared today. Be well, and we will see you all soon. Have a good the rest of your afternoon.
Bye, everyone.
Bye.